Hi, I'm Dr. Blythe.
And I'm Nurse Ashley.
Welcome to Aesthetic Smiles. We're going to do a TMJ consult today. So a lot of patients will come in with an array of different symptoms related to TMJ or TMD pain.
When somebody comes in, a lot of times they come into the dentist and they're asking for a consult based on their pain with their grinding and clenching and bite and things like that. But a lot of times they don't realize that it's the hypertrophy of the muscle that we can also assess and treat. So I'd like to show you how we like to use his expertise and my expertise, and then we can cover all the bases when it comes to your jaw pain related to TMD or TMJ.
As a dentist, we focus first on teeth, then the surrounding structures that operate the teeth, i.e. the jaw joint up here. So first thing I'm going to look for is how even or balanced is the actual bite of the teeth. Next checkpoint is going to be the motion and function of the actual jaw joint. So I'll have a patient open and close a few times. I'll have a patient open and close a few times. Look for any shifts or clicks or pops. Next, based off of a 3D scan, we'll map the evenness and levelness to their bite and figure out if there's an origin in the pain there. If that's a no, we call it Nurse Ashley.
So what I'm looking at is the muscles. So what I do is I come in and I want to look at the hypertrophy of the masseter muscle. I want to look at the hypertrophy of maybe the temporalis muscle and then the pterygoids. So those three muscles oftentimes can cause us a lot of pain. So I like to say that if they're hypertrophied, then that is causing problems. So we want to be able to bite, we want to be able to talk, we want to be able to use our face and use our mouth. But a lot of people are grinding when they're stressed, they're grinding when they're sleeping, they're grinding when they're driving, and that's what we don't want. So I'll go in here and I'll have you clench. Good, relax, clench. Good. Okay, so just based on this assessment, I can feel that her masseter muscles are hypertrophied. So when she clenches, they're bulging out like this. What that does is it actually can make your face look more boxy. So a lot of women like to get masseter injections for the aesthetic reasons, but also it can start to cause a lot of pain. So the masseters, when you're clenching, they're going to start to initiate and kind of activate these temporalis muscles, and a lot of people will start to have pain up here. Go ahead and clench. Right, so this masseter muscle and this temporalis muscle, it's too big or it's enlarged from overactivation. So what we can do with neuromodulators like Botox, Dysport, Xeomin, Jeuveau is we can actually go in and we'll do 1 or 2 injections per site, and then we can come in and we can do some injections in here as well. And it is like amazing. So once injecting these muscles, the relief can start within 7 to 10 days. This is one of our favorite procedures because people come in and they've had pain for years and years. We've had people that have gone to oral surgeons, other dentists, ENTs, and they come in here and with a few simple injections to the masseters and then temporalis muscles, sometimes you can go back and you can start treating some of the muscles in the back and things like that. That's more kind of migraine related, but it's focusing mostly on TMD and TMJ. With just a few simple injections, you can give relief for up to 6 months. And sometimes you can actually block that neural pathway that the brain starts handling stress or it starts dealing with different things like that. It's not going to clench and grind as much. And with him kind of getting your bite right or getting your mouth guards in place, with these two things, sometimes we can actually make it so you don't even have to come back and see us anymore for this. Or if you are continuing to have pain, you can come back about every 6 months. So we like to say, like with every cleaning, we can just go do a few more injections and give you relief and prevent you from breaking teeth and things like that, which cost you more money with Dr. Blythe.